Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Ya, terima kasih teman-teman untuk kehadirannya. Kita akan tunggu. Give me 1 second. Sorry. Yes. Mohon maaf, barusan saya mendengar background suara dari YouTube. Ya, kita nunggu beberapa menit lagi untuk mempersilakan teman-teman yang lain untuk bergabung. Saya berharap mereka mendapatkan emailnya. Mudah-mudahan tidak masuk ke spam ya, barangkali. Jadi kita tunggu beberapa menit, akan kita mulai segera. Terima kasih. Untuk adik-adik yang tahu teman-temannya sudah daftar, disilahkan diingatkan, dibagikan saja Zoom link-nya, terus sampaikan bahwa acara sudah dimulai.
Yep. So we're gonna give another minute.
Aduh, apa? Aduh, jangan Kak saya.
Yeah, we're gonna give another minute to the other friends to join this event. Thank you so much for your patience. And Orges, if you wanna, hello, Orges.
Can you hear me okay?
Yeah, yeah.
Okay, excellent. Hello, everyone.
Hello. Let me make you the co-host.
Okay, and I'll share my screen.
Yes. So, teman-teman semua, the way we're gonna do this, so there will be 3 parts of the sharing session. The first one, we would have a very brief remarks from the department chair or pharmacy department at Tadalaka University. And then second, we will have the president of the student body of the pharmacy department at Tadulako University as well. So, and then we will jump right into the main event, which is a sharing session by Orges Alabaku. So, yep, we did try this screen sharing. It works pretty okay. And then now we have 53 participants minus 2, me and Orges. So that would be about 51. And I will mute myself super quick. Okay. Okay, let's start. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Yep. Thank you so much, everyone, for being here together in this sharing session event. I will switch bahasa Indonesia and then English multiple times in this event, so bear with me. Puji syukur kehadirat Allah Subhanahu wa taala yang telah memberikan karunia dan nikmatnya kepada kita semua sehingga kita bisa hadir di tempat ini dalam rangka belajar, kemudian sharing pengetahuan. Kita juga menghadirkan teman dari sini, Amerika Serikat, dari University of Pittsburgh. Mudah-mudahan ada manfaat dan pelajaran yang dapat didapatkan dari kegiatan ini. Kemudian tak lupa juga kita kirimkan salawat serta salam kepada junjungan kita Rasulullah Sallallahu Alaihi Wasallam, karena Nabi Muhammad yang telah menunjukkan kita sehingga kita bisa sampai di zaman yang lebih baik dan era yang terang benderang ya. Alhamdulillahirabbil alamin. Yep, without further ado, oh by the way, perkenalkan, nama saya Rudi. Saya adalah salah satu staf pengajar di Universitas Tadulako. Saya dan teman-teman Himafar berinisiatif untuk melakukan kegiatan ini dalam rangka ya berbagi pengetahuan dan sebenarnya I will speak in English right now. Jadi Orges and I are kita mau berbagi tentang outcomes research. We want to share about outcomes research. Mudah-mudahan ini bidang yang lumayan tidak familiar ya di Indonesia. Sudah ada tapi tidak sefamiliar, tidak sebanyak di Amerika Serikat. Ya, sambil menunggu teman-teman yang lain, kita sudah punya 81 partisipan. Dan seperti yang saya katakan, saya ingin mempersilahkan kepada Ketua Jurusan Departemen Farmasi Fakultas Matematika dan Ilmu Pengetahuan Alam Universitas Tadulako untuk memberikan pandangan, kemudian juga special remarks, juga mungkin pesan kepada adik-adik semua yang sempat hadir dalam kegiatan ini. Untuk itu, saya mempersilahkan kepada Dr. Syariful Anam untuk memberikan sambutannya. Disilahkan kepada Pak Syariful.
Yes. Apa ya? Baik, saya pakai bahasa, nanti saya gabung. Ya. Ya, baik. Assalamualaikum warahmatullahi wabarakatuh. Selamat malam, salam sejahtera buat kita semua. Pertama-tama yang saya hormati ada sekretaris jurusan ya, Ibu Sekretaris Jurusan, Ibu Kurator Program Studi, Bapak Ibu dosen, dan mahasiswa semuanya, dan tentunya our special speaker dan Pak Rudi sudah memberi kesempatan, memberikan effort untuk sehingga sharing session hari ini bisa terlaksana. Pertama-tama marilah selalu kita senantiasa memanjatkan puji syukur kehadirat Allah Subhanahu wa taala, Tuhan yang Maha Esa, karena berkat rahmat hidayah kita bisa bersilaturahmi pada malam ini, walaupun melalui virtual dan terpisah dengan jarak ya, baik dari Rudi maupun pembicara malam ini. Namanya siapa sih? Aku lupa. Ya, Orges. Bagi yang Muslim, saya juga mengajak untuk menyampaikan salam dan salawat kepada baginda Rasulullah SAW, Muhammad SAW. Ya, secara umum saya berterima kasih kepada Pak Rudi sudah bersama Himafar tentunya memfasilitasi acara ini, karena secara umum sih mungkin materi yang diberikan mungkin ada yang sama dengan di materi dari dosen, ada juga yang berbeda, dan saya kira ini bisa menjadi pengayaan atau penambahan wawasan kepada mahasiswa farmasi Untad khususnya dan mahasiswa farmasi secara umumnya, karena saya tahu peserta pada malam ini tidak hanya dari farmasi Untad, juga berasal dari di luar Untad ya. Jadi saya berharap kedepannya acara ini tidak hanya satu kali tentunya Pak Rudi, kita ingin ada continue Mungkin kita bisa buat dalam hal yang lebih simple, mungkin kita bisa buat, karena kita sudah punya Instagram Farmasi Untad, kita bisa buat live IG, jadi lebih mudah diakses begitu ya, dibandingkan Zoom. Kalau Zoom kan biasanya harus buka laptop dan sebagainya. Nah, kalau kita menggunakan live Instagram mungkin jadi lebih mudah buat teman-teman, adik-adik mahasiswa. Saya kira itu yang bisa saya sampaikan, dan sekali lagi terima kasih buat Himafar, ada ketua Himafar juga di sini, Ananda Aksalam Ismail, yang mampu menangkap peluang bersama dengan Pak Rudi bagaimana melaksanakan acara yang sangat-sangat positif. Saya yakin apapun itu pasti ada hal yang nyangkut lah di malam ini, wawasan yang membuat mahasiswa nantinya jadi lebih mengetahui, karena di sini kita akan membahas pharmacy education in the USA and introduction of to health services and outcome research. Saya kira ini juga sangat tepat sekali buat mahasiswa farmasi di Indonesia. Saya kira itu Pak Rudi, silahkan dilanjut acaranya. Saya mungkin akan mendengarkan, mungkin ada yang bisa saya tangkap juga sebagai pengajar nanti di sini. Saya kira itu. Terima kasih. Sekian. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ya, terima kasih banyak Pak Syariful atas sambutannya. Dan yang kedua, silakan kepada Saudara Aksalam Ismail selaku Ketua Himafar untuk memberikan sambutannya. Oke.
Ya, Kak. Baik, terima kasih Kak kesempatannya. Assalamualaikum warahmatullahi wabarakatuh dan selamat malam. Jadi singkat saja mungkin saya ingin berterima kasih kepada tentunya yang pertama jurusan farmasi, dalam hal ini ada Bapak Kepala Jurusan. Kemudian saya juga ingin berterima kasih kepada teman-teman yang sudah hadir. Semoga sharing session ini bisa memberikan manfaat bagi kita semua. And special for Sir Rudi, thank you so much for everything, for your help, sir, from beginning until now. And also thank you so much for our guests for spend your time with us. I hope you enjoy this session. I think that's it, sir. Thank you so much.
Okay, thank you so much for everyone. Terima kasih kepada Pak Syariful, terima kasih kepada Adik Aksalam telah menyampaikan sambutannya. Untuk itu, kita sekarang akan masuk ke acara inti. So now we're going to jump right into the main event, which is sharing session with Mr. Orges Alabaku, and the floor is yours. I will hand over the microphone to the speaker. And before starting the event, I'd like to let everyone know, probably like after 3 or 4 slides, I will kindly interrupt Orges to emphasize some, like essential points for the Indonesian students to, understand. Karena mungkin dari tiap 3 mungkin atau 4 slide ada hal-hal yang bisa kita bandingkan atau kita coba lihat apa yang kita punya di Indonesia begitu. Jadi ini juga saya sudah minta izin. I have asked permission from Orges. Jadi seperti itu ya. Kalau I really understand that teman-teman, I see that this is my thing. Like I'm so, it's just hard for me to switch between Bahasa and then English, but I'll try to do my best. But long story short, I have asked permission from Orges that I will kindly interrupt him. I know everyone can understand what he's gonna say, but I will still probably translate 3 or 4 slides like in super brief sentences so everyone can fully grasp the main points of the materials. Okay, I will hand over the microphone to Orges, and the floor is yours, bro.
You can hear me, right?
Uh-huh.
Okay, great. So let me just start off by saying big thank you to Rudy, of course, but also big thank you to Tadulako University for organizing this event. And then an even bigger thank you to everyone that's attending, because to be honest, I didn't expect as many people, as much interest from all of you. So I hope that you all learned something and that you find value in this event. And please, as I go through the slides, feel free to ask any questions. You can put them in the chat, or I'm sure we'll have a short session at the end where you can ask questions, and I'll try to answer as many as I can. So with that, as Rudy mentioned, my name is Orges Alabaku, and I'm a 4th year and in my final year of pharmacy school. And let me just, so my kind of the objectives of today, I'll give some background on myself. I'll talk about the pre-pharmacy education in the US. I'll talk about pharmacy school in the US. And then I'll talk about what's called health services and outcomes research, which is a field that I'm interested in and what I want to pursue as a career after pharmacy school. So just a little bit about me. I'm originally from Albania. I was born there in a small town or city called Kuchova, which is right about there. And then I moved to the United States when I was about 6 years old. I moved to Massachusetts, a small town outside of Boston. And that's where I grew up. That's where I went to school until I went to university, where I went to the University of Pittsburgh. And there I had a great time. I studied pre-pharmacy for 2 years and then ended up going to pharmacy school. And as I mentioned, this is my 4th and final year of pharmacy school. So to talk a little bit about pharmacy in the US. So there's a few different paths that people or students in the US take to end up in pharmacy school. So a lot of people like me usually do 1 or 2 years of undergraduate study, and this is known as pre-pharmacy. And during this time, they take a couple of core courses. So like biology, chemistry, calculus, statistics. And once they complete these courses, they're allowed to apply to pharmacy school. And if they get in, they'll attend pharmacy school for the next 4 years. However, there's a lot of other groups of people that come to pharmacy school with bachelor's degree. Some, but not as common, have masters. And even less common, you see sometimes a PhD student who's graduated with a PhD, a doctorate, and then they come to pharmacy school. And students do this because they want a new experience. They might have a bachelor's in biology, they worked for some time, and they realize that they want to do pharmacy. So they go to pharmacy school. And as a student in pharmacy school, I appreciate this because it allows me to interact and have classmates with different backgrounds and different experiences that we can learn from and share. So I mentioned the pre-pharmacy curriculum. So these core courses that you have to take to enter pharmacy school, and you do these in university. And so some of them I've mentioned here, but they're very general. So like introductory physics, statistics, calculus, some chemistry courses in labs, biology, English writing, and a few different electives. So these are generally true for all pharmacy schools in the US, that they require some sort of combination of these courses. And you can see there aren't that many courses, so you can get it done. Students do typically complete these in 2 years, but some even in 1 year. So once you enter pharmacy school, what are the goals of the pharmacy school in the US? So ultimately, the pharmacy school in the US, the #1 goal is to prepare students to be future healthcare professionals. And that's the ultimate goal. But in addition to that, pharmacy school in the US is also committed to helping students be leaders, innovators, and collaborators. And these are important because, as I'll mention in my next few slides, but pharmacy students in the US, once they graduate, a lot of them do go and become healthcare professionals and they work as pharmacists, but a lot also go into other fields that aren't direct patient care related fields. And this is where being a leader, being an innovator, being a collaborator comes in, as you use a lot of these skills in a wide variety of fields. that don't necessarily require, that aren't necessarily related to patient care.
Excuse me, August.
Yeah.
Yeah. Yeah, could you please go back to the previous slide? With the 4 things first. So pre-pharmacy, yeah, there you go. So super quick. Jadi teman-teman semua, perbedaannya kita di farmasi di US dan di Indonesia. Jadi settingannya memang dari awal sudah berbeda. Nah di sini mungkin juga saya makin mengerti bahwa esensi dari basic science itu tetap ada. Nanti dipertajam lagi ke apa namanya, ada pelajaran-pelajaran farmasi yang di PharmD program atau Doctor of Pharmacy program. Nah, Orges telah menyatakan bahwa jadi kalau di sini itu sebelum masuk ke farmasi program, jadi PharmD program, Doctor of Pharmacy atau disingkat PharmD, itu mereka harus lewati ada namanya 1 sampai 2 tahun undergraduate study. Jadi apa namanya, tidak bisa langsung dari SMA. SMA-nya juga 4 tahun ya di sini. Dari SMA langsung loncat masuk ke farmasi begitu. Jadi tidak bisa seperti itu. Jadi harus lewati dulu ada namanya pre-pharmacy school. And then yang tulisan bachelor's degree, master's degree, PhD, kadangkala ini ada orang-orang yang memilih menyelesaikan dulu bachelor's, kemudian baru masuk ke PharmD. Ada yang selesaikan master's dulu, baru masuk ke PharmD. Ada juga PhD masuk ke PharmD begitu. Tapi dengan cukup 1 sampai 2 tahun, setengah ada kalanya 3 tahun, mereka masuk ke PharmD. Jadi tidak bisa langsung dari SMA. Could you please go to your next slide? Yeah, these are the basic curriculum for pre-pharmacy school. Jadi ada calculus, ada yang statistik, teman-teman bisa lihat, ada physics, kemudian foundational biology and labs, chemistry atau kimia dalam bahasa Indonesia, kemudian ada English writing sama electives. Nah, jadi teman-teman bisa lihat bahwa inilah kurikulum yang harus diambil selama 1 tahun sampai 2 tahun. Bisa jadi 3 tahun juga atau 4 tahun, terserah dari orang yang belajar. Intinya jadi harus ada dasar-dasar ini tadi. Jadi ada dasar-dasar biologi, dasar-dasar kimia, dasar-dasar organic chemistry ya. Begitu. Jadi di sini ada perbedaannya, nanti kita akan bandingkan dengan PharmD curriculum. Next slide. Ya, ini juga sudah jelas. Silakan. Go ahead, Orges. Go on.
Okay. But as I mentioned, the number 1 goal of pharmacy school is to prepare students to be pharmacists and to be healthcare professionals. So what does that mean in the United States? What are some of the things that pharmacists are able to do, and what are their responsibilities once they start working? So some things I wanted to highlight. So manage chronic diseases. A lot of pharmacists work and they have regular patients that they see frequently, maybe say every 6 months, and they assess the patient's blood pressure. They look at the patient's cholesterol. They look at the patient's blood sugar if they're diabetic, and they counsel that patient and they talk to that patient and be like, "How this is how your blood sugar is now. You're at the goal that we want you to be, and this is what you're going to continue to do." They help as the most common thing everyone recognizes. They verify, they prepare, they check medications to make sure the patient's receiving the right medication. They do wellness screening. They talk to patients and they recommend different screening. So if a patient is a diabetic, they recommend that patient get their blood sugars checked every day. Or if they might have high cholesterol, they help that patient schedule appointments to get their cholesterol checked every year. They do over-the-counter medication counseling or non-prescription medication counseling. As we know, these medications aren't always, there's instructions on how to take them. You can't take them as you would like, as there can be side effects. And we have pharmacists to counsel patients and to help patients pick the right one for them when they may need one. They provide vaccines. And I think this is something unique in the US, where pharmacists are able to vaccinate. And this is true since the 1990s. but it's expanded. So every state in the United States allows pharmacists to vaccinate anyone over the 18 years of age or older. And this is true for pharmacy students as well. Pharmacy students can vaccinate if they're working with a pharmacist. They counsel on prescriptions. They make sure that the patient understands what medication they're receiving, how to use it, why the medication is being used. And they interpret drug interactions. And this is a big one because in the US, a lot of the older patients, they see a lot of doctors. They see a cardiologist, they see a dermatologist, they might see their regular doctor every year. And when you have so many doctors that are seeing the same patient, there's room for error, where one doctor might give one medication and another might give a different medication, but there's no communication between those two doctors. And what happens is there could be a drug interaction, and it's the pharmacist's responsibility to make sure that the patient's on the optimal drug regimen and there's no problems and the patient doesn't have any side effects. And in fact, there's studies that show that patients see their pharmacist a lot more than they see their doctor. So there's a lot more room to intervene and catch any problems. So these are some pictures I wanted to show you. So I mentioned vaccinations. So this is a picture that I found. So pharmacist vaccinating a patient. It looks like this is probably COVID-19 vaccine or maybe flu vaccine. But you can see in the background this is a pharmacy. So patients go to a pharmacy and they get vaccinated. This is another photo I pulled, and this is actually from the West Virginia University website. And this is a pharmacy student. And then this is a colleague or professor. And he's giving her the COVID-19 vaccine. And then this is just something else I wanted to include, and this is a picture of what's called morning rounds. So there's the doctor, and there's probably a nurse in here, a medical student, a respiratory therapist, and as well as a pharmacist who all work together, and they talk about each patient case in the hospital, and they come up with a recommendation. And the pharmacist's job in this group is to provide the medication recommendation based on the patient's needs and profile. So here's some photos of me in my time in pharmacy school. I didn't include these people's faces, my friends, because I didn't ask them permission. But so this is me and one of my close friends in pharmacy school. And this was when I was a first-year pharmacy student. And here we're presenting on a poster, or we are promoting an organization called Reach Out and Read, which is an organization that promotes early reading in children. So we were handing out free books to children like about 5 years of age or younger. And this on the right is me and another one of my friends, and we are presenting a poster on antibiotics and antibiotic resistance and how to use antibiotics properly. So you can see in pharmacy school, I've had some opportunities to go a little bit further beyond just curriculum and practice some communication skills and talking with patients and talking with people and teaching them things, which I really appreciated. So with that being said, I wanted to go into kind of some basic things that are covered in pharmacy school in the US from year 1 to year 4. So year 1, it's very basic courses or very foundational courses, such as anatomy, biochemistry, or we have what's called community service sites, which are the sites that students would go to interact with people. So they might be tutors and tutoring high school students, or they might work at a company where they help individuals pick health insurance plans, or they work at a clinic where they might talk with patients and register patients for the next appointment. And not all of these are healthcare related, but all of these build on communication skills with patients that anyone who's going to work in healthcare is important to have, to be able to talk effectively with patients and be able to explain things to patients. Year 2 is where pharmacy school in the US starts getting into the disease states and disease state management. So for example, like cardiovascular disease, and how is cardiovascular disease treated? Pharmacokinetics, how are drugs distributed in the body? Gastroenterology, so GI, like stomach and small intestine, large intestine diseases, and how those are treated. And nutrition, drug development, how are drugs developed that lead to approval and then being able to be sold in a pharmacy. So this is where we start covering some of those therapy courses, and we start learning them. And something I just wanted to point out, as I think when I was talking to Rudy last night, he mentioned, so each of these blocks or squares on my screen are different courses, all in themselves. So we focus on one course entirely on cardiology, and then an entire course entirely on infectious diseases. And each course has its own professor and own exams. And yeah, so, and then year 3 is we go into even more therapeutic courses where we're taking immunology, pulmonology, rheumatology, endocrinology. We take a course on pharmacy law, as this is important because once a student graduates from pharmacy school, they're required to take a pharmacy law exam in order to get a pharmacy license. And the law exam is different in every state in the United States, since every state in the United States has slightly different laws regarding pharmacy. So these laws can cover anything like how many, like something as simple as how big can a pharmacy be for a certain number of patients, or how can you fill a prescription? How many days do you have to fill it? When does a prescription expire? And things like that. We take oncology and hematology, critical care, nephrology. Again, individual courses focusing on the therapeutics. And then year 4, the final year, is entirely dedicated to practice. So there's no more courses, no more exams. And everyone in year 4 goes on a series of rotations, and there's 8 different rotations. Each rotation lasts about 5 weeks. And each rotation is a unique field of pharmacy. So the goal here is to get students to get exposure to each different field of pharmacy so that when they graduate, they have an idea of kind of what they enjoy and what they want to do after they graduate. So one more thing I wanted to mention, so students are partnered with a mentor in each of the fields. So that mentor would teach the student everything that they would want to know.
Okay, so could you please go back to 3 or 4 slides before that? Yes, that one. So in short, secara singkat untuk yang di sini, ini kita juga sudah lakukan ya di Indonesia, farmasisnya sudah sangat baik. Cuman perbedaan dari apa yang tadi yang dijelaskan, kita di sini sudah manage chronic diseases. Ada sedikit perbedaan di situ. Di sini apoteker ada beberapa states yang bisa langsung bahkan ada itu published article yang menyatakan bahwa apoteker bisa meresepkan begitu, tapi dia harus ada di bawah naungan ada namanya CDTA. Jadi ada Collaborative Drug Therapy Agreement. Jadi bisa langsung menangani chronic diseases. Kemudian Orges also mentioned about verify, prepare, and check medications. We already have that back home. Kita juga sudah punya itu. Kemudian wellness screenings di sini di Indonesia barangkali sudah ada kayak monitor glucose, cholesterol, and what else? Uric acid, and ada beberapa yang lainnya ya untuk screening. Tetapi kalau di sini itu bisa bahkan sampai screening diabetic neuropathy, bahasa Indonesia neuropati diabetik. Kemudian juga ada untuk mengarahkan pasien untuk cancer screening cancer ya. Jadi banyak di sini. Kemudian ada tadi OTC counseling, sama di Indonesia kita sudah melakukan itu. Kemudian vaksin. Nah, ini dia, this is the main difference. Kalau di Amerika, pharmacists they are allowed to vaccinate. Mereka boleh mengadminister atau menyuntik vaksin. Itu perbedaan yang paling besarnya. Kemudian ada counsel on prescription, we also have that. Interpret drug interactions, for sure, we do have that too. Jadi memang ada slightly difference ya. Jadi ada slight difference between United States and Indonesia, tapi kita lumayan bagus lah. Could you please go to the next slide? Yes, ini gambar kalau farmasis bisa memvaksinasi dan juga ada round, ada kayak morning report atau apapun namanya. Jadi kita berkumpul, kemudian kita diskusikan. Di Indonesia kita juga sudah punya ini khususnya untuk rumah sakit yang ya relatif besar barangkali, tapi ini memang ada stase-stase khususnya untuk pasien-pasien yang tertentu juga. Ada clinical pharmacist atau farmasi klinis yang bertugas untuk memantau pengobatan dari pasiennya. Next slide, bro, please. Ya, tadi kegiatan Orges with his other friends sudah dijelaskan juga. Next slide, please. Ini kurikulumnya secara general mirip dengan apa yang kita punya, tapi Orges also mentioned that like here we have like block systems. Jadi di tier 1 tidak terlalu di sini dasar-dasarnya farmasi yang ada di depan kalian, anatomi, biokimia, biokimia dan lain-lain. Kemudian di year 2 ini block systems. Jadi ada cardiovascular diseases sendiri, kemudian infectious diseases sendiri, dan itu ada rentang waktu di mana mereka harus belajarnya itu saja begitu. Jadi memang sistemnya dari awal sampai akhir selama kurun waktu tertentu cuman itu saja yang dibahas begitu. Next slide please. Year 3 same thing, block system, endocrine, kemudian immunology, kemudian population health, law, ke hukum-hukum tentang farmasi, kemudian cancer dan lain-lain begitu. Next, ya di tahun keempat, jadi mereka clinical rotations untuk ini ya finishing sampai pada mereka bisa graduate begitu. Yep. Yeah.
Okay. So this is just a table that summarizes some of the differences from the pharmacy in the US and then Indonesia. And I created this with Rudy's help. So I will talk about the US portion and then I'll let Rudy speak on the Indonesia part. So as I mentioned, in the United States, there's pre-pharmacy school. As you complete those first requirements in biology and chemistry, and then you do your doctor of pharmacy program or your pharmacy school, which again is 4 years. And then while in pharmacy school, you're required to have a clinical hours experience. So the minimum requirement is 1,500 hours. 1,000 hours you get from your school through the different patient interactions that you have. And then 500 hours, it comes from work experience. So students work in pharmacies. They might work at a store pharmacy or they might work at a hospital, and they have to receive at least 500 hours of experience in their jobs. So once you have your hours, you graduate pharmacy school. Pharmacists at this point, after they graduate, need to pass a license exam. So there's the NAPLEX, which is the pharmacy license exam, and then the law exam. So these are two different exams. But once you pass both of them, students then become licensed pharmacists. And these pharmacists can then practice as pharmacists in any site. Now, some pharmacists at this point go on to do extra training and what's called residency training. So residency training typically lasts 1 to 2 years. And pharmacists do this training because they want to specialize in a specific disease state or a specific field in clinical pharmacy. So the first year of residency training is very general, where pharmacists are focusing on cardiology, infectious diseases, pediatrics, and so on. The second year of pharmacy or pharmacy residency is specific, and they pick one of those things. So they might be in infectious disease, or they might be in cardiology. So they're specializing in one field. And then once they finish their 2 years of residency, pharmacists then have an option to take a board certification exam. And if they pass this exam, they're considered board certified. In other words, they're somewhat of an expert in that specific field of clinical pharmacy, so maybe in cardiology. And the reason pharmacists do this is because it opens up a lot of job opportunities and unique job opportunities where you work in hospitals and you become a clinical member working with a doctor and other hospital staff to help patient care. Then I'll let Rudy take on Indonesia.
Oh, oke. Ya, jadi perbedaannya dengan tadi ini kayak summary dengan apa yang telah kita bahas sebelumnya. In Indonesia, we don't have pre-pharmacy school, and then in Indonesia, sistemnya beda. In the US, Doctor of Pharmacy it comes as a package, satu paket. Kalau kita itu dia terpisah, jadi bachelor degree in pharmacy, and then ambil ada pharmacist professional degree, jadi ada profesi apotekernya. Nah, kalau di Amerika clinical hours-nya 1.500, kalau di Indonesia ini sepanjang yang saya ketahui ya, jadi memang ini juga saya rujuk dari kurikulum APTFI, professional practice hours in Indonesia itu ada 3 rotation setidaknya. Beda lagi ada beberapa universitas yang specialized di industri only, kemudian ada yang di pelayanan, itu akan seperti di Universitas Indonesia itu seingat saya dia terpisah, dia beda settingan dari rotationsnya. Setidaknya pokoknya kalau untuk apoteker kita punya hospital, community pharmacy, and then industry. Kemudian ada juga yang ke pemerintahan, saya tahu ini ada. Lalu ada NEPLEX di sini untuk pharmacist licensure examinations di Indonesia kita juga sudah punya. Kita punya UKAI, kemudian kita juga punya OSCE ya, OSCE yang nasional. Nah, karena kita nasional, jadi kita tidak non applicable ya, jadi tidak ada jurisprudence exam seperti di Amerika. Kemudian ada optional residency training. Kalau di Indonesia, kalau dulu ada namanya spesialis farmasi rumah sakit, tapi untuk beberapa alasan, for some reasons they changed it. Jadi bukan dari spesialis farmasi rumah sakit. Saat ini tidak ada lagi SPFRS, mungkin akan dibuka lagi segera, saya berharap begitu. Tapi teman-teman kalau sudah apoteker itu bisa ambil ada master's degree di clinical pharmacy. Nah, ini juga dia ya setara juga sama teman-teman yang ambil S2 bidang teknologi, fitokimia, bahan alam, ataupun mikrobiologi farmasi dan lain-lain ya. Tapi ini spesifik untuk yang clinical pharmacy ada master's degree-nya. Dulunya settingannya itu lebih ke arah SPFRS namanya. Kemudian di dalam clinical pharmacy we have 4 clinical rotations. Jadi masing-masing universitas mengesetnya berbeda. Kalau di yang telah saya lalui kita punya pediatrics, kemudian geriatrics, ICU, and then oncology atau cancer. Itu rotationsnya ya. Jadi setelah PharmD, setelah apoteker itu ada lagi residence, ada kayak training tambahannya. Kalau di Amerika ada namanya PGY1, PGY2, kayak istilahnya specialist. Jadi ada area yang sudah lebih spesifik. Kalau di Indonesia saat ini yang kita punya adalah spesialis radiofarmasi atau nuclear pharmacy di Bandung, setahu saya. Nah, terakhir optional board certification ini bisa diambil kalau dulu di Indonesia. Dulu seperti saya bilang ada spesialis farmasi rumah sakit, kalau sekarang belum ya, kita punya sertifikasi secara nasional sebagai apoteker general ditambah dengan ada yang namanya spesialis radiofarmasi. Yep, that's all.
Okay, and next thing I want to touch on is career opportunities after pharmacy school. So I talked a little bit about some pharmacists who graduate and then they do residency training for 2 years. And then I said that those open up some more opportunities and jobs. But generally, these are the most common paths that pharmacists take after they graduate. So the first one is retail pharmacy, or it's like working at a store, and you're checking orders there, and you're filling medications that the patient comes with a prescription from a doctor. And to do this kind of job, you don't need any postgraduate training. So what I mean is you graduate from pharmacy school, and these pharmacists can then work in this setting. Hospital pharmacists, similarly, can also work at a hospital with no postgraduate training. They graduate pharmacy school, and then they can work in this setting. But this is a little different. Hospital pharmacists is a little different from clinical pharmacists, both typically work in hospitals, but a hospital pharmacist is verifying orders that the doctor is sending for a patient that's in the hospital, and that pharmacist is then checking the patient's labs, they're checking the vitals, they're making sure that the patient is not taking any other medications that interact, and then they'll verify that medication then gets filled and is sent to the patient in the hospital. A clinical pharmacist, these are pharmacists that did residency training. They did 1 or 2 years, and then they're working with the doctors on the unit. So they're not so much, they're not verifying as much. What they're doing is that they're talking with doctors, they're talking with nurses, they're talking with the medical students, and they're making sure that the patient is on the right drugs or on the right medications, or if the patient should maybe remove one of the medications or add something else. And then they're working and making those decisions with the doctors. And then there's pharmaceutical industry, and this is a little further away from healthcare, because some students, when they graduate pharmacy school, they end up working in pharmaceutical industry, which is companies like Pfizer or Moderna, as you probably have heard of now. And in these companies, these pharmacists are doing a lot of different things. They can be in marketing, so dealing with how to commercialize a drug and how to advertise it to the public. They're working with drug safety. They're making sure that the drug or the medication that the company is making is safe, and the patients who are taking it are seeing benefits. They're working with regulatory. What that means is they're working to make sure that the company is following all the rules and laws that are set in place by the government. They might be doing pharmacoeconomics and outcomes research. So what that means is maybe they're looking at the cost of the drug that or the medication that the company is producing, and how that compares to another drug or another medication that another company is producing. Or what are the outcomes? Are the patients seeing benefit from this medication? And how does that compare to another company and the medication that they're producing? And then finally, there's research. And I started research for 2 reasons. One being that this is what I'm interested in. But second is because research, I don't want it to think of as its standalone thing, because any one of these pharmacists can do research, and any one of these pharmacists' experiences are valued in research, because research is a collaborative effort and a collaboration of more than one information that come together to ultimately improve patient care. Because everyone, whether they work in industry or they work in a hospital, they're all pharmacists, and their goal is to advance patient care. So I wanted to touch on what kinds of research pharmacists can get involved in. So there's preclinical research, which is research before a medication enters a human or a person. There's clinical research, which is a study. So what is outcomes research? So this is can you hear me okay? Because I just got a thing that said unstable.
Yeah, I don't understand what's going on, but I can hear you.
Okay, perfect. So so outcomes research is what my interests are in. So this is an area of research where you measure results of various medical treatments or interventions in a population. So it's not just about medications, but it can be about, like I said, an intervention. So maybe a surgery. And it's a lot of data analysis to see what are the benefits of this intervention, what are the benefits of this medication, and how does it compare to what already exists. So it's improving the data that's out there to help clinicians, to help doctors, to help pharmacists make better decisions in healthcare. So kind of, I touched on it, but the purpose, right, is to assist patients, to assist clinicians, purchasers, policymakers in making informed healthcare decisions. And this is done by giving more evidence. So you conduct studies that show that one medication has less side effects than another. And that will change guidelines on which medication is used first in a patient. So the process involves identifying, measuring, and evaluating effects of care provided to patients. So there's three big project types, I guess, that make up outcomes research. One is economics, the second is clinical, and the third is humanistic. Humanistic focusing on health-related quality of life. And to go a little further in this, I'll give examples on each of those topics. So from an economic perspective, someone in outcomes research would ask a question such as, what are the costs and consequences with the use of alternative pharmaceutical products and services? So looking at the cost and how it compares between services, between medications, between interventions. And what is the benefit? If you're paying more for something, is there an added benefit that you're getting? And a lot of times you don't know if the research hasn't been done. Clinical, from a clinical perspective, what's the risk, the benefit, and the effectiveness of a medical treatment and service or a pharmaceutical product? So again, comparing a product, an intervention, a treatment, and its benefit, risks, and effectiveness. So this will help inform as what's the first thing that is done for this specific patient with this specific concern. And third, what impact does an individual's health status have on their quality of life? And this is an equally important aspect because as healthcare professionals, you want to understand what the patient's goals are, what the patient values, what does the patient report as an improvement in their life when they're given a treatment, when they're given a medication, and is that worth it? Is it worth the cost? Is it worth the risk? And these studies try to assess those to have better evidence to make better decisions in the future. And then this kind of brings it all together. And as you can see, outcomes research, and honestly, research in general, is a collaborative effort from different perspectives. But in this case, you want to look at the patient perspectives and their values. What does the patient want? What does the patient value as improvement? You want to take a clinical experience, and you want to take pharmacists, you want to take doctors, nurses. You want to take what they know about a specific disease state or a specific problem. Then you want to conduct the research, and you want to conduct that outcomes research. You want to provide more evidence. And you combine all these three together to make good clinical decisions, and then ultimately to improve patient outcomes. And then finally, I want to talk a little bit about what's called pharmacoepidemiology. And this is the more specific, it's a more specific subset of outcomes research. And as a pharmacy student in training, this is what I really enjoy, because this is where you take a disease state and you take medications and you combine them in research. So what does this look at? It's a study that of the utilization and effects of drugs in a population. It's going to provide an estimate of the probability of beneficial effects of a drug in a population and the probability of adverse effects. So you can see it's outcomes research because you're looking at some sort of outcome. You're looking at what is the benefit, what is the risk. But in this case, it's only on medications. And it allows for evidence to be generated to be able to compare one medication with another. And it allows evidence to be generated to see how medications are being used over time. Has one medication decreasing in use and why? Is one medication increasing in use and why? So it's generating those types of evidence. And then also, what are the costs associated with the medications? And is an increase in cost showing a better benefit or an increased risk? So these are the three pharmacoepidemiology projects I've worked on that I wanted to share just to give an idea of the kind of opportunities that exist. So one of the first projects I worked on was on the relationship between early changes in immunosuppressive therapy and hematologic events in lung transplant patients. So again, it's looking at immunosuppressive therapy, and it's looking at how that affects blood-related side effects, but specifically in lung patients or lung transplant patients. Another project I worked on, this was a project with Rudy, was a review of cost effectiveness of secukinumab in the management of psoriatic arthritis. And again, this one is looking at an outcome, but in this case, it's a cost outcome. And how does cost of secukinumab relate to other costs of other similar drugs or medications when you're talking about psoriatic arthritis. And then finally, this is my most recent project I'm working on right now, but and this is the poster that I worked on. But this is looking at trends of FDA-approved cancer therapy since 1995, and it's looking at how have progression-free survival or overall survival changed for patients who are taking these medications. So, what does the future of outcomes research look like in the U.S.? And this is an article from 2014 or 2014, but I really like it because of a quote here that I think summarizes it really well. And I think, but this quote is mostly, it's talking about pharmaceutical industry, but I think you can apply it to a lot of different things. And the quote says, pharma needs to sell the story of a strong value proposition for its products, and health economics and outcomes research is the way to do it. And the reason that summarizes it really well, because it doesn't just have to be pharma or pharmaceutical industry. It can be anything, right? So as a clinician, as a pharmacist, or as a policymaker who's writing guidelines, in order to do that, you need evidence, and you need to sell that story. You need to prove that this method is the best way to improve patient outcomes. And that's done through research and evidence, and ultimately outcomes research. So what are the career...
Yeah, I just want to interrupt you a little bit. Could you please go back to the outcomes research?
Yeah. This is actually my last slide. So
okay. You can finish it up then.
Yeah.
Okay, go ahead.
So what are the just to wrap it up? So what are the career opportunities in the US after someone completes pharmacy school, and then they may go on to do an outcomes research PhD, or have some sort of master's degree in outcomes research? They go on to work at the CDC. They can work at the FDA, WHO, pharmaceutical industry. They can do academia, and then centers for Medicare and Medicaid services. But obviously, there's a lot more. These are just some big ones that I wanted to mention. But that's all my slides. Yes, Rudy. Where would you like me to go?
Give me 1 second here. Yeah. Before I, finish up the explanation, summarizing the outcomes research part, untuk teman-teman, feel free to put your questions or your responses, anything in the chat. Give me 1 second. Okay, so jadi outcomes research itu sekarang saya tidak tahu kenapa, saya mohon maaf ya, karena I really apologize, my screen is frozen and I don't want to do anything about it because if I did something, that would probably like log off of the Zoom, and then that would it's just like I'm having issues with my computer, and I cannot see anything on my screen. It's just like frozen. So I will just try to summarize the outcomes research sesuai dengan based on the knowledge. Because I'm sorry, Orges, I cannot see your screen at all.
I see.
Can you hear me? Yeah.
Yeah, I can hear you.
Yeah. Okay.
I mean, feel free to talk. It's okay.
Yeah. No, jadi teman-teman sekalian, di outcomes research itu dia lingkupnya kurang lebih sama dengan kita sebenarnya sudah mengenal itu. Jadi ada 3 ya, kita bilang eco. Jadi economics, kemudian humanistic, sama clinical. Jadi ada 3 aspek cabang dari outcomes research. Nah, di Indonesia kita sudah punya itu, bahkan juga kita punya mata kuliah di Universitas Tadulako pun kita juga punya mata kuliahnya. Ada yang cabangnya, tetapi istilah outcomes research ini kalau menurut saya ya di Indonesia itu jarang, tidak sesering di Amerika digunakannya. Tapi pada dasarnya outcomes research itu sudah lumayan banyak kita gunakan, tapi secara fasilitas tadi kayak yang Orge sampaikan ya, kadang kita menggunakan penelitian itu untuk yang cabang tadi economics seperti pharmacoeconomics, kemudian ada yang clinical aspek, kemudian ada yang humanistik. Nah, jadi kita bisa untuk yang melakukan penelitian-penelitian ini, kadang-kala kita butuh dataset, kadang kita butuh registry. Di Indonesia, sayangnya, kita belum terlalu kaya dengan apa namanya, ya sumber daya tadi ya, datasetsnya, claims data. Sebenarnya sih kita sebenarnya bisa ya, kita kalau kita mau inisiasi, kita guide BPJS mungkin kalau mereka mau membuka datanya, kemudian kita link dengan data Badan Pusat Statistika, kemudian kita lihat faktor demografinya dan seterusnya. Itulah kurang lebih yang disebut dengan outcomes research. Nah, Orges is interested in pharmacoepidemiology. So the combination of the pharmaco aspect, jadi aspek farmakonya, kemudian epidemiologinya. Epidemiologi itu mempelajari tentang determinants atau factors affecting like one particular disease. Itu bisa apa namanya, dia melingkupi ada demografi, kemudian ada clinical factors dan banyak yang lainnya. Dan Orges sangat apa ya, he's looking forward to studying even more tentang pharmacoepidemiology. Lalu terakhir apa namanya, di bagian belakang tadi career opportunities, kalau di Amerika dengan bidang outcomes research ini bisa bekerja di banyak tempat, di CDC, Center for Disease Control and Prevention. Kemudian kita sudah seringkali citasi ya, CDC itu apa namanya, dia punya data. Kemudian kita juga bisa kerja di CMS, Center for Medicare Medicaid Services, itu yang asuransi besar di sini. Kemudian kita bisa kerja di industri farmasi, karena memang ini apa ya, istilahnya itu mengevaluasi obat-obat yang telah beredar. Kemudian kita juga bisa kerja di akademia if you want, atau kerjanya di lembaga penelitian juga bisa, di NIH, banyak lah ya. Di Indonesia pun begitu, dengan outcomes research ini idealnya apa ya, bisa membantu kita dalam memberikan pelayanan. Karena kita sudah mengetahui bagaimana perbandingan dua obat, kenapa kita pilih obat A dibanding obat B, kenapa efek samping dari obat A lebih besar daripada obat B. Tapi yang paling mendasar outcomes research itu adalah salah satu dia punya resources ya, kita bisa menggunakan datasets, databases yang mungkin kalau di Indonesia kita sudah punya lumayan banyak registry. I believe in Indonesia we do have some cancer registries. Di Jakarta itu saya pernah juga hampir penelitian di situ. Namun mungkin karena sistem pendataan kita yang seringkali masih belum apa, sangat computerized, jadi sukar untuk di-compile datanya. Jadi outcomes research ini bisa juga dilakukan di menggunakan apa namanya tuh, medical records. Jadi di rekam medik Indonesia itu kita juga bisa pakai untuk penelitian outcomes research. Mudah-mudahan tidak berbasis kertas. Kalau dia paper based itu lumayan sulit. Tapi itu tetap bisa begitu. Ini merupakan area yang sangat potensial untuk kita kembangkan. Bisa juga melalui survei. Tadi Orges also mentioned ada bagian dari, there's a part of outcomes research yang kita bisa melakukan survei. Jadi kita questionnaire begitu. Tapi secara general dia bisa aspek ekonomi, humanistic, and clinical. Yep, that's all we have today. Feel free to send your questions in the chat. Or if you want to speak up, you can raise your hand and we will allow you to direct your questions to our guest. Ya, silahkan. I don't know how should I, oh my God. I just don't know how to fix my computer. But I don't want to mess around with it. Orges, can you hear me, everyone? Yeah. Okay. Ya silahkan kalau ada pertanyaan, mungkin Aksalam atau Syahrul atau teman-teman yang lain bisa dibantu saya lihat chatnya untuk dibacakan pertanyaannya. Kita harus improvisasi di sini kayaknya, karena saya tidak bisa lihat apa-apa. Okay, let me see if I can see the chat. Or guys, can you see questions in the chat?
No.
No. Aksal, can you hear me?
Iya, Kak.
Okay. Untuk teman-teman, feel free to ask your questions. While me trying to fix this. Hello?
There's a question in the chat.
Oh, okay. Unfortunately, I cannot see it.
Pertanyaannya
Silakan.
dari Pak Syariful Anam. Jadi pertanyaannya, farmasi di USA apakah ada UKI-nya juga?
Okay. Yeah, the question is, in the US, do we have a national board exam?
Like a license exam?
Yes, license exam.
Yes. There's so once a student graduates from pharmacy school, they have to take a national board exam, and then a law exam as well.
Well, yeah. What is it called?
The law?
What is it called? What is the national board exam?
It's called NAPLEX.
NAPLEX. Okay. Yeah, we do have that in the table.
Yeah, I can probably find it, but and then the law exam, and so the NAPLEX is national, so the whole U.S. as a country gives the same NAPLEX, but the law exam is different based on which state in the U.S. you're in, because each state has different laws regarding pharmacy, slightly different.
Okay. All right. Yeah. Now I'm using my phone. Ya, teman-teman yang lain ada lagi yang mau ditanyakan? Ada yang mau langsung bertanya? And feel free to speak bahasa. Jangan takut nanti dibantu untuk translasinya. Ada yang lainnya? Let me see the chat. Aksal, Syahrul?
Yes, sir.
Yes, sir.
Ya. Kalian punya pertanyaan?
Dari ke Muhammad Syauki kayaknya, sir.
Oh ya, silahkan Muhammad Syauki. What is your question? Do you wanna deliver your questions directly, or do you want to wait? Silahkan Muhammad Syauki. Muhammad Syauki. Muhammad Syauki. Syauki, can you hear us?
Yes, iya Pak, iya Kak, bisa.
Oh ya, silahkan.
Terima kasih atas kesempatannya. Jadi di sini sebenarnya pertanyaan saya hampir sama dengan yang ditanyakan tadi sama Pak Syariful Anam. Kan kalau di Indonesia ada yang namanya UKAI untuk untuk jadi standar seorang farmasi itu apakah layak dia bisa untuk bekerja sebagai seorang apoteker atau tidak. Kan kalau di Amerika ada apa tadi namanya NAPLEX. Ya, NAPLEX.
Yeah.
Jadi yang ingin saya tanyakan di sini, apakah untuk Amerika sendiri itu, apakah itu menjadi standar sebagai seorang farmasi, seandainya mereka tidak lulus itu, apakah mereka bisa bekerja sebagai seorang farmasi atau tidak? Kan kalau di Indonesia itu sendiri, kalau kita tidak lulus UKAI, tidak bisa kita bekerja sebagai seorang apoteker karena tidak mendapatkan STR ataupun SIPA.
Ya.
Jadi kalau di Amerika sendiri, apakah seandainya tidak lulus, apakah tetap bisa menjalankan profesi sebagai seorang apoteker atau bagaimana, Pak? Itu sih yang saya tanyakan. Terima kasih.
Ya, terima kasih Muhammad Syauqi. Yeah, Orges, the question is, so what would happen if someone did not pass the NAPLEX exam? Are they going to be, allowed to work as something? Is that like a must for all pharmacists in the US to pass that exam? Then they can go into, the field. Orges, you're on mute.
Sorry.
Right?
Yeah. So good question. So if a pharmacist wants to practice pharmacy, so they want to work with patients, they want to work at a pharmacy, they want to work at a hospital, they need to pass their NAPLEX. And they don't, obviously this is not, they don't have to pass it the first time. You can, I think you can take it up to 5 times. And you just have to pass it one of those 5 times. But as I mentioned, there's a lot of different fields. So if someone who graduates from pharmacy school and ends up in academia as a professor, or they end up doing research as a professor, or they go into pharmaceutical industry, so like a company like Pfizer, and they're working with them, they don't need a license as a pharmacist because they're not working with patients. Their jobs there are very different. They're working in marketing, they're working in pharmacoeconomics, and the company values their pharmacy experience as a student, values their clinical knowledge, but doesn't require that pharmacists have a license exam.
Okay. Ya, itu tadi Muhammad Syauqi ya. Jadi ada 5 kesempatan. Kemudian jika tidak lulus, jika tidak lulus di pertama bisa mengambil sampai 5 kali, sampai intinya 5 kali kesempatan kalau untuk bisa lulus. Kemudian ada juga pekerjaan-pekerjaan yang tidak perlu NAPLEX. Jadi dia bisa kerja di industri, pharma company, atau dia bisa kerja di lembaga penelitian yang tidak memerlukan itu karena memang tidak bersentuhan langsung dengan pasien. Nah, kemudian ada pertanyaan di chat. We have some questions in the chat. So let me paraphrase this. So can a bachelor degree of pharmacy work in the US, specifically in a community setting or clinical setting? I believe the questions, because this question is from Husnul Diana. So Husnul Diana is asking whether someone with only bachelor degree in pharmacy, like, are they allowed to work in the US
as pharmacists?
As anything, in the clinical setting or community setting, like in a pharmacy?
Yeah. So I believe that the answer is no.
Okay.
I think so. The US system is built where it requires the doctorate of pharmacy program that's offered in the US. Because I've had friends who came to the US with a bachelor's in pharmacy and they ended up doing a PhD here. And the bachelor's of pharmacy is not sufficient for practice. Now, with that being said, I think that there's a way to get from a bachelor's to being able to practice. I just don't know the exact requirements. But like I said, like there's that 1,500 hours of clinical requirements that pharmacy, that the US system requires before you can even take the license exam. but I think
see.
the rules are pretty strict in
Mhm.
terms of the requirements. And I don't know if Rudy can speak on this.
Yeah. No, I totally get it. And also we have like, another options. You know, there's another part of another route of pharmacy education, right? Pharmacy tech. Jadi,
Yes.
yeah, they can take that, but still, if they don't have the clinical hours for pharmacy tech or PharmDs, then they're not allowed to work in the USA. Ya, jadi tidak bisa kalau sarjana farmasi tidak bisa kerja apapun di clinical setting atau di community setting. Tidak bisa kerja di farmasi, harus jadi either PharmD or pharmacy tech atau asisten apoteker. Di sini juga ada asisten apotekernya. Sekolahnya terpisah. Shirley Wijoyo, si Shirley Wijoyo, ini pertanyaan. The question is, if we want to take PhD in the US, what do we need?
Yeah, I think Rudy, you're the best answer for this one, since you have first-hand experience. So
but you can answer, you're applying.
I mean, yeah, but I'm applying, but as living in the US, you're.
Okay.
So
I'll take it over then. Jadi Shirley Wijoyo, terima kasih Shirley atas pertanyaannya. Jadi kalau yang diperlukan itu pertama TOEFL, jadi Test of English as a Foreign Language atau IELTS. Kemudian itu ada standarnya masing-masing universitas berbeda. Kemudian yang kedua, kita perlu menunjukkan academic performance yang baik dengan standar 3,00 rata-rata, itu yang diperlukan. Then you also have to have a personal statement. It's the same thing. I think like every applicant needs to provide some type of like motivation letter or personal statement or like some type of essay telling the stories about yourself in the past. Kemudian ada study objectives, juga bisa kita harus buat, kita mau kerja apa, kita mau lakukan apa setelah edukasi kita selesai. Terakhir, kalau kita mau daftar PhD itu, kalau bisa ada 2 rute ya, kita bisa dapatkan beasiswa dulu baru apply universitasnya, atau kita cari universitasnya baru cari beasiswanya. Beda, jadi nanti dibaca kembali LPDP ataupun Fulbright ataupun there are many other scholarship available. Or you can actually directly apply to the universities, and then if you get accepted, then the universities will pay for your tuition, will pay for your stipend, even though you are international students. Jadi bisa seperti itu, bisa dibiayai oleh kampus di sini. Tidak perlu beasiswa dari Indonesia, itu intinya. Selanjutnya, from Armini Syamsidi, ini disebutkan bahwa the question is, from your slide you mentioned that you have a pharmacy law class. Could you please explain what the general topics are in that class?
Yeah. So I mentioned that I went to school at the University of Pittsburgh, which is in Pennsylvania, which is a state in the United States. So in that class, I learned about Pennsylvania pharmacy law, every single thing that's written for pharmacy law. So how long does a prescription last before it expires? Like when it's written by a doctor and you get that paper, how long does it last? How do you transfer? What's the law for when you transfer a paper for a patient that says fill this medication, but you can't fill it because you don't have that medication, so you have to take it to a different pharmacy? What's the law for that? So literally anything, and the US is highly regulated on these, and there's very specific laws for every single thing that happens in a pharmacy. So it's learning about those laws. Because once students become pharmacists, they need to know them in order to make sure that they're following every rule that are put in place. Because if they don't, the consequences are pretty severe, where you could lose your license, get fined, and even prison time, depending on the severity of the law.
Yeah. Jadi macam-macam hukum-hukumnya sama dengan kita, yang dari yang saya lihat di sini di West Virginia University ataupun the one that Orgus just mentioned. The curriculum is pretty close to what we have in Indonesia. So pharmacy law class, it talks about jadi yang menulis resep itu siapa, kemudian berapa lama bisa bertahan, bisa berapa lama bisa valid. Kemudian kalau misalnya ada kecurangan, kalau di Amerika ya, kalau ada misalnya kayak pemalsuan resep, bagaimana aturannya, bagaimana cara penyelesaian kasusnya. Kemudian jadi aspeknya lumayan sama saya bandingkan dengan apa yang kita pelajari. Dan di sini kalau di Amerika sangat ketat sekali. I just want to emphasize, Orgus, about like in the US, you cannot get prescription drugs filled easily. Jadi di Amerika tidak bisa kita mendapatkan obat keras sembarangan. Obat yang diresepkan itu tidak bisa. Yang prescribed medications, they have to be prescribed. We have to have the prescription, go to pharmacy, then we can get them. Itu yang paling besar sekali masalahnya ya, kalau di Amerika itu ketat sekali. Bahkan natrium diklofenak itu tidak bisa keluar dari apotek jika tidak ada resep. Natrium diklofenak begitu. Di asam mefenamat juga begitu ya. Di Indonesia mungkin agak berbeda kasusnya. Okay, Armini Shamsidi said thank you so much for the answer. And then the continuation of the Husnul Diana's question. In Indonesia, bachelor degrees of pharmacy can work as a pharmacy tech. In the US, tidak bisa, Husnul Diana tidak bisa, walaupun dia sudah sarjana, tetap harus ada clinical hours. Jadi memang in the US, clinical hours are very crucial and they have to fulfill that. And then next question, Orgus, is there also a timeline for that? Do you have to renew your pharmacy license?
No, I don't believe so. So I think once you get your pharmacy license, every year pharmacists are then required to do some trainings.
Okay.
I believe it's like 30 hours a year, or 30 credits. I'm not sure how many hours, but it's considered 30 credits per year. And as long as they keep up with those trainings, they don't never ever have to take the exam again.
I see.
It's a one-time thing. You pass it, and unless you move to a different state in the United States where you would have to retake the law exam, because the law is different in each state. But the NAPLEX, or the pharmacy license exam, is only a once. You have to pass it once.
Okay. Yep. Armini Shamsidi. Jadi once you get the license, then it will last forever. However, you have to renew there's something called continuing education, or CE. And jadi mereka harus ambil sekitar 30 kredit setiap tahunnya, itu ada. Sama juga di Indonesia. In Indonesia we do have such thing. Jadi kita harus renew surat praktek kita, izin praktek kita begitu, kurang lebih. Tapi kalau untuk national board examnya only one time diambil. Next question from Lilik Andriani. Lilik Andriani asks, so if I was a bachelor, if I graduated from pharmacy school in Indonesia with bachelor degree, and then I want to continue my study in the USA, for example, master's or even PharmD, first, is it allowed? Second, are there any required subjects, that need to be provided or like required for the program? So in short, bachelor degree of pharmacy wants to continue their study for masters or PharmD. Is it allowed?
Yes, it is. So if you have a bachelor's, you most likely have all the requirements that are needed to go to pharmacy school in the US. if that's what you would like. And similarly, you probably also have all the requirements for a master's degree. So maybe there's some schools in the US that maybe require maybe some extra course or something, but I think for generally most schools, you would be okay to apply with a bachelor's for pharmacy and a master's.
Okay. I see. Yeah, jadi bisa ya. Yes, you are allowed to go for higher degree, for example, master's degree or PhD. Jadi bisa. Nanti ada ketentuan-ketentuannya. There are requirements. Ada. I think you also have to provide TOEFL score, IELTS. Some. A test of English as a foreign language, something like that. Because we are internationals. Kalau master kayaknya lebih mudah dibandingkan master's degree. Is easier compared to PhDs in terms of like us going to the US and doing this. Kalau kita mau apply lebih mudah dia. Lalu dari Pak Aulia Arta, hello, I'd like to ask, does the foreign pharmacy graduate? So may the foreign pharmacy graduates work in the US? Are there any requirements to be fulfilled in general? Thank you in advance for the answer.
Wait, can you repeat that, Rudy?
Yeah, so do foreign pharmacy graduates, may. So yeah, so can the foreign pharmacy graduates work in the US?
Like as pharmacists or as?
Yeah, I guess so. That's the question.
Yeah, like I said, I think yeah, go ahead, Rudy.
No, I was gonna say, I think I've read like there is one. It's called FPGEE, foreign pharmacist. I can't recall what the abbreviation stands for, but it's basically there's like an exam just to prove that we are as qualified as the US PharmDs. I've read it. It's like FPGEE, foreign pharmacist exam.
Okay. So yeah. So I haven't heard of this. So how about this? So Rudy and I will research this together, and then we'll get back to you. So I'm not sure how, Rudy, what do you think is the best way to?
Oh yeah. Putri Aulia Arta. That's the person who is asking the question.
Yeah.
But yeah, I'm pretty. Yeah, we'll try to reach out to you once we get done with this webinar. We'll make sure that the answer is that is provided is valid. Kita akan coba cari informasinya. Tapi as far as I know, yes, there is like an exam that you have to pass. Jadi, tapi we'll get back to you. And then dari Padilla, thank you, Mr. Orges, for your answer. You look so handsome. Wow. Look, you already have. I believe you have lots of fans back home already in Indonesia. And then dari from Muhammad Takdir, hello Orges, I believe you have. Wait a second. Yeah, so Muhammad Takdir is wondering about your impression about pharmacy in Indonesia. I know that you're not really like exposed much,
right,
but to your knowledge or like anything, basically, that's what he's asking.
Yeah, and I think probably Rudy is an expert at this point because Rudy has worked with pharmacy students in the US, so he knows the curriculum and he went to school in Indonesia. But I think some things that from talking to Rudy, what I know of. So the US is making big pushes to expand pharmacy, to expand what pharmacists can do. And this is something that talking to Rudy, I don't think is as common in Indonesia, where pharmacists are considered the typical pharmacist, the baseline pharmacist, which is verified check orders. So, but as far as that, I think that's a big difference, and I think I think the curriculum is very different too. Where so I don't know if you noticed, but in the U.S. There isn't so much focused on I don't know what the word is, but like molecular structures or anything like that of drug, like chemical reactions or like any biology, chemistry, like it's more of a therapeutic overview. So what drugs are there? How do those drugs work in terms of what are the side effects? Why does a patient take it? How does the patient take it? And things like that. That's the focus in the US system, where I think talking to Rudy, the Indonesian system is a little bit focused on the structure and reaction-based drug perspective. And Rudy can correct me if I'm wrong.
Okay. Ya, jadi itu impressionnya ya. Jadi, tapi ini kan memang sangat subjektif. Jadi intinya kalau menurut Orges, jadi ada perbedaan. Yang pertama itu perbedaan kurikulum. Jadi perbedaan kurikulum juga saya sudah tunjukkan untuk kurikulum di Indonesia seperti apa. Memang pertama kalau di sini sistemnya blok, jadi per penyakit. Kemudian kalau di Indonesia mungkin ada sedikit universitas yang sudah mulai mengarah ke sistem blok, tapi rata-rata sekolah farmasi di Indonesia masih belum sistem blok. Terus yang kedua juga dari sisi kewenangan ya, authorities in the US, like you see dalam presentasinya, Orges showed that pharmacists in the US are allowed to administer vaccine, we are allowed to vaccinate here. Kalau di Indonesia kita belum bisa menyuntik begitu. Kemudian ada beberapa juga yang pharmacist prescribing in some states ada konteks namanya collaborative drug therapy agreement di mana pharmacists are allowed to prescribe, but there's in certain manner ada kayak kayak aturan-aturan tertentu di mana farmasis bisa melanjutkan presepan dari dokter spesialis yang telah memberikan resep. Ada aturan-aturan tertentunya begitu. Intinya mungkin ada sedikit perbedaan. Kemudian di Indonesia memang saya harus akui kita sangat kita sangat bangga dengan area yang kita punya juga, karena memang kalau di Indonesia kita banyak belajar cabang-cabangnya farmasi itu sangat luas. Jadi kita punya phytochemistry, kemudian pharmacognose, and then we also have banyak lagi yang lainnya, dan juga kita sangat mendalam dalam konteks medicinal drugs. Medicinal chemistry. Nah, kalau di Amerika tidak terlalu sedalam yang kita pelajari di Indonesia, itu sudah jelas, karena di sini tidak ada phytochemistry, tidak ada pharmacognose, tidak berbeda konteksnya ke arah sana, karena memang arahnya memang kalau di Amerika itu ditekankan betul-betul lebih ke pelayanan PharmD-nya. Kalau memang mau lanjut ke new drug discovery ataupun ke kayak outcomes research, mungkin yang statistics whatsoever, itu they can go for master's degree or PhDs. Itu tadi Muhammad Takdir. Oh ya, Aksalam Ismail, terima kasih. Maybe Orges you can also see that. Aksalam Ismail says there is an exam for international pharmacy graduates. Namanya it is called Foreign Pharmacy Graduate Equivalency Examination. Ya, silahkan tadi Pak Putri Aulia Arta, I believe. Yep. Yeah. If you have any more questions, please reach out to us. But it's already 9:42. I'd like to ask one more time. Does anyone else have any other questions? Ada yang masih punya pertanyaan lain? Silahkan. I know it's bad time. It's bad time in Indonesia already. It's 9:43 p.m. So yeah, some people might want to go to bed soon. If there is no more questions from the audience, I would like to thank you all for attending this event. Then, August, do you have concluding remarks?
Yeah, just big thank you to everyone for sticking along, asking questions. If there's something that you think of after, I'm sure you can find a way to reach out to Rudy, right, Rudy? Can they find a way to reach out to you? Perfect. And then Rudy will he might know the answer, or he'll ask me, and then we'll be happy to answer it. But yeah, so thank you for your attendance. I hope that you found this enjoyable, educational, and yeah, have a good night.
Oke, terima kasih. Thank you so much, everyone. Terima kasih Pak Syariful, Ketua Jurusan Farmasi Universitas Tadulako, Fakultas MIPA. Kemudian juga Ibu Sekretaris Jurusan, Ibu Yuliet. Kemudian terima kasih juga kepada Koordinator Prodi, Ibu Armini Syamsidi, sama teman-teman semua. Thank you so much for everything. Thank you for your support. We're looking forward to seeing you all in the next event that we might hold. Thank you so much. All right, bye-bye. Have a good night, everyone.
Bye.
Bye.